Hi everyone, I'm Dr. Jyoti Priya. I'm working as consultant nephrologist in MGM Muthoot Medical Center in Kerala. Today, I'm here on behalf of the social media team of Indian Society of Nephrology Southern Chapter Conference 2024, which will be held from 8th February to 11th February 2024 at Hyderabad. And today we are having a session of pre-conference interview, and we have with us none other than Dr. Anil Kumar, consultant nephrologist and renal transplant physician at Manchester Royal Infirmary, United Kingdom. It's an absolute pleasure to be with you, sir. We are indeed very fortunate to have you with us today and also for the ISN Southern Chapter Conference at Hyderabad. To begin with, Dr. Anil, could you please introduce yourself and share with us your background in nephrology and also what exactly inspired you to work in the field of glomerular disease? Over to you, sir.
Thank you, Dr. Jyoti, and all the social media team and all the delegates. It's a pleasure to meet you all at some point. And as you said, my name is Anil Kanigicherla. I'm also called Durga in my professional circles locally here. I come from Andhra in India, South India. I've been here in Manchester for the last 20 years and work in the field of glomerular diseases and, of course, the general nephrology and transplant nephrology as well here in the Manchester University hospitals. So it's a great pleasure when I was invited to give a talk on the glomerular disease aspect of membranous nephropathy. It's clearly an important aspect, a thriving disease in terms of research, etc. So I look forward to conversing with you all and meeting you all.
Thank you, sir. You'll be in a very special session at ISN South Chapter Conference, and you'll be talking on the journey of anti-PLA2R antibodies in membranous nephropathy, which is, of course, a very relevant topic. So could you give us a glimpse of your talk and also what will be your focus of your talk and topic in ISN SouthCon and why this topic is significant for the nephrology community?
Yeah, a very important question because we know that kidney disease is vastly present across the world. The varieties of kidney diseases include majority of them are glomerular diseases or diabetes or genetic diseases and a few others. So if there is some disease where you can stop or treat, I think glomerular diseases comes at the forefront. The others are, of course, preventable diseases, in my view, like the diabetes, etc. So glomerular diseases having understanding the biology in terms of the kidney disease, the immune system, and the intricate relationship between the mechanistic aspects is what actually intrigues most of us to join nephrology in the first place, I think. My involvement with glomerular diseases and especially membranous nephropathy was something which I shared from my senior colleagues here in Manchester. Since I started training, of course, the magnificent PLA2R journey, PLA2R molecule has been discovered to be involved in this disease. And it, of course, was a groundbreaking exercise because for 50 odd years, no one knew what precisely caused this disease, although there were several mechanistic studies over the last several decades. And it was, I think, the breaking moment in the field of MN. And of course, it leaves us with a vast area to pursue in terms of changing the trajectory for these for this type of kidney diseases. Hope to see more of them.
Okay, thank you. And in your view, what are the most groundbreaking advancement in the field of nephrology, especially in the field of glomerular disease?
Glomerular diseases are generally considered rare disease, but we know that they constitute 15 to 20% of patients with end-stage kidney failure. So it is a big chunk, although they are considered to be rare diseases. And it is well recognized that actually rare diseases hold the key a lot of times to understanding the molecular mechanisms, which actually unravel some of the aspects in terms of therapeutic interventions with many other diseases as well. So the groundbreaking one that we know of back 30 years ago was the RAS inhibition, which again was a molecule that was identified, the pathway was identified through the renal circulation. And thereafter, in the recent past, it took a long time for us to discover and utilize the importance of SGLT2 inhibitors, for example. That has been groundbreaking in terms of nephrology. With the glomerular diseases per se, I think it's this single molecule and the proteomics and metabolomic studies which will help understand the physiology, pathophysiology, and thereafter lead us into the interventional aspects. And PLA2R, of course, there are several things within MN which are coming on. There is a plethora of interventions in terms of either generic molecules or specific targeted therapies in these conditions. So yeah, I think the next 2 decades, hopefully we'll see less and less of glomerular diseases.
Yeah, definitely we can hope like that.
Yeah.
And how important is international collaboration in field of nephrology, especially in research and academic activities?
I think it goes without saying that it is extremely important. And we know that all these diseases have different phenotypes in different ethnicities across the world. Certainly, IgA nephropathy, and it's a well-recognized phenomenon. Certainly in MN, we don't particularly appreciate the differences, but there is certainly plenty of commonalities between across the world. In terms of nephrology per se, it's extremely important that we partner, especially when it comes to rare diseases. I might have 100 cases of MN over 10 years. That's about it. But the huge collaboration, the registry studies, both the national and international, I think are going to be extremely important in trying to unravel the disease pathogenesis, interventions, and of course, the collaboration in terms of networking with professionals, the next generation of budding doctors and medical students. It's look forward to more of these in the future.
So, from your biodata, I understood you studied in Nizam at Hyderabad, and now you are coming back to Hyderabad for this conference. So, it would be very nice if you could share your excitement and enthusiasm in visiting Hyderabad, like just like back to home feeling. Or what is your feeling on that, sir?
Oh, absolutely. I still have friends in Hyderabad and, of course, colleagues, a couple of them between Gandhi Medical College, Nizam's, Osmania, etc. So I keep seeing them every now and again, and it's always a pleasure to meet them, see the hospitals there again, connect with my background. And of course, that's home. So my parents don't live far away from there. So I look forward to joining you all.
Thank you, sir. Sir, in our conference, we'll have several nephrology residents, young trainees, early career nephrologists. So, as a senior nephrologist, nephrology faculty, what is your message or a piece of advice to these young budding nephrologists, as well as to the entire delegates who are attending this conference?
That's a big thing, but I think if there is one thing that I would say, follow your heart. You chose the right specialty. Nephrology is crucial because although we all choose nephrology for kidney medicine, many of us choose nephrology because it is integral to the human body. And I haven't found anyone who said otherwise. So yeah, do the best, follow your seniors, and yeah, plenty of reading and hard work. Yeah, it's hard work doing residency. I recall it 15, 20 years ago. Yeah, plenty of night shifts, etc. But yeah, it's all worth it at the end because what matters is changing people's lives, and that's what we're here for. So always look at the bigger picture.
Thank you. Thank you so much, sir. And thank you for being with us and for taking your valuable time with us today and also for being a part of ISN South Conference at Hyderabad. We are really excited and eagerly looking forward to hearing from you in ISN Southern Chapter Conference 2024. So viewers, this talk will be held on 9th February 2024 at 5:30 p.m. So do not miss to attend ISN Southern Chapter Conference, which will be held at Hyderabad from February 8th to February 11th. So do join us, and definitely it will be a great academic feast. Thank you.